Welcome, everybody. I really appreciate you coming to Asinta and Alliance quarterly country insight webinar today. I'm excited for our partners in Mexico, Intertec, and our U.S. partner in the United States to provide you with some information about employee benefits in Mexico. With that, I'm going to pass the microphone and the floor over to my co-host, Mark Juno at Alliant Insurance Services. Mark, if you could go ahead and introduce yourself and our presenter today, that would be great.
Great, thank you, Wendy. I'm Mark Juno. I'm the Director of Global Employee Benefits Consulting for Alliant, as Wendy just mentioned. An important part of our work with consulting with multinationals is coordinating with local partners around the world, and our Asinta partnership is a key part of that. Today you'll be hearing from Rodrigo Fernández, who is with Intertec, our Asinta partner in Mexico. So with that, Rodrigo, would you like to take it away?
Thanks, Mark. Hi, everyone. Thank you very much for joining us in this webinar. Over the next few minutes, we're going to talk about our country, Mexico, the employee benefits provided by our government, and the ones provided by employers through insurance companies and brokers like us. As most of you may know, my name is Rodrigo Fernández, the Property and Casualty Director in Intertec. And of course, here with me is Fernando Garciadiego, who is the Employee Benefits Director. First of all, we would like to introduce the company in which Fernando and I are partners, Intertec. Our company was established 35 years ago, and our team is formed by 5 partners and 6 employees. Intertec's principal activities are related to the risk management, employee benefits, insurance and surety bonds brokerage, and actuarial consultancy. We're mainly focused on prospects and clients that are medium to large size with local and global operations. Now a little bit of our country. It's, Mexico's official name is United Mexican States. Our government is a federal republic formed by a president, a chamber of deputies, and a senate, and a judicial Supreme Court. Our country is divided in 32 states, including our capital city, Mexico City. And our official language is Spanish, as most of you may know, and most of the population is Catholic. The next one. Mexico is the second largest economy in Latin America and is the 15th largest economy of the world. Our country has signed 3 trade agreements with 46 countries, so we're considered to have one of the most open trade policies in the world. We're showing also in this slide some important indicators of our economy. Maybe the only one that I am going to mention is the daily minimum wage salary, because some of the benefits provided are in minimum wage salary terms. Our daily minimum wage salary is about $4.5 US a day. And as you may know, one of the main problems in our country is that the income distribution remains unequal. Just as an example of this is that our president's monthly income is 84 times bigger than the monthly minimum wage salary. Now it is time to talk about some of the employee benefits granted by law. There are 3 government institutions that manage the employee benefits granted by law. They are the Mexican Institute of Social Security, the Retirement Savings System, and the National Institute of Workers' Housing Fund. Some of the minimum legal benefits for employees in our country are the Christmas bonus or the aguinaldo. That's how we call it here. Then the vacation premium and the profit sharing. Some companies increase the terms of these benefits on behalf of their employees. As you can see in this slide, we're showing the federal labor laws vacation day table. And on the other hand, we're showing some of the public holidays considered by most of the companies in our country. Let's move on to the main theme in this presentation, that are the employee benefits private plans. We're going to divide the most common private benefits provided by employers in health plans, which can include major medical expenses, minor medical expenses, dental plans, vision plans, and wellness programs. Then the life insurance and their additional coverages, such as the A&D, or dismemberment and funeral expenses, the saving funds, and the retirement plans including legal severance, reserve, and seniority premium. Talking about the health private plans, we're going to start talking about the major medical expenses programs. Well, this benefit is one of the most important factors for Mexican employees when they are considering a job offer. As an example of this, 93% of the global companies established in our country offer this benefit to their personnel, while only 60% of the Mexican companies grant it. Major medical expenses programs may differ from one provider to another one in their underwriting process. In the sum insured offered, their minimum deductible, some particular losses or coverage, and the reduction or elimination possibility of the deductible and coinsurance in case of using the insurance company's medical network. Some of the similarities that you can find are their criteria for considering a group policy instead of an individual policy. In the benefits they offer to a group policy, that most of the providers offer coverage in Mexico and in the event of an emergency and international limited coverage. That in small groups or individual policies, it may apply waiting periods, and all of the policies apply 48 months of waiting period for HIV or AIDS. In this table, we're showing you the average sum insured for major medical expenses programs for some of the most common economic sectors. As well, we're also mentioning the most common deductible coinsurance on birth and C-section limits. Here are some of the special clauses and conditions that companies and employees in Mexico are looking for to be included in their programs, such as the catastrophic coverage in terminal diseases, also the coverage for medical complications due to a not covered condition, the portability of the program, that is the right to convert the group coverage into an individual policy, the surgical fees catalog, and it is also important to consider that 73% of the contractors provide this insurance to the employee, the spouse, and their children. Well, now it is time to talk about the minor medical expenses programs in Mexico. Well, these programs are not very successful in our country if we compare them with major medical expenses ones. The insurance companies that provide minor medical insurance through a closed service network, which is the greatest weakness of these kind of programs, provide the following services: the health prevention and maintenance, the medications, the discounts in diagnostics, and also odontology services. Dental and vision plans are commonly considered by companies as additional coverages and benefits for their contracted medical expenses program. And the difference between each plan may be the deductible, the copayments, or the mix of them, and the mix also of selected coverages. These two coverages can also be considered and contracted as a separate policy. Now we're going to talk about wellness programs. Some facts, such as the reduction of insurance premiums and operational costs, considering employee productivity reduction, increased absenteeism, and incapacities and claims of major medical expenses, are the main reason why wellness programs are taking more relevance in Mexico. To complement this, well, what I told you the last slide, let me give you some related information. 43% of the companies in Mexico are in process to implement or have implemented wellness programs, and 20 of the 34 insurance companies have contracted or are contracting a wellness provider. Well, as you may see in the following list, according to the Welfare Council at Work Mexico, the most common health risks in a Mexican organization are related to some kind of overweight or obesity. Mexico has the second global prevalence of obesity in adults and ranks the first in the world for child obesity. So that's the main problem of our organizations. Here are some of the wellness services provided or that are well known in Mexico. The first one could be the online assessment, the evaluation, identifying health risk groups, health plans design, health fairs, and some strategic plan design. Now we're getting to one of the most common and high appreciated benefits. We're talking about the life insurance. In life insurance plans, as it was also mentioned, for major medical expenses policies, may differ from one provider to another one in the underwriting process also, the ages of participation, some special classes that you can get from each provider, the size of the group, and most of the global companies in Mexico grant a private life insurance, while only the 50% of the national companies do so. The main difference between unionized and non-unionized employees is that for unionized, the sum insured will be in their collective labor contract, and in most of the cases will be a fixed sum insured, while non-unionized sum insured will be established as a number of monthly salaries. In this slide, as we showed it before, we're showing the most common insured sums expressed in months of salary for some important sectors of our economy. So, total and permanent disability, AD&D, and funeral expenses are considered the most important additional benefits in a life insurance program. For total and permanent disability, the employee is entitled to lump sum payment and waiver of premiums. We're going to talk about some about the savings fund in Mexico. Here are some of the rules that must be followed so that the companies may grant 13% of their employee salaries, and they shall receive it tax-free at the end of the year. This benefit is considered as a one-year term saving plan, and it is a salary saving agreement between the employee and employer, in which the employee is saving the same amount that the employer will contribute. Now we're getting to the retirement plan section. Since the 1996 reform of the Mexican Institute of Social Security, retirement plans became more important. Let's consider that the retirement ages in Mexico for early retirement are 60 years old, and for normal retirement it will be 65 years old. Plans granted by law are divided into a defined benefit plan for employees who start working before June 1st of 1997, and a defined contribution plan for those who start working just after June 1st, 1997. Talking about the private retirement plans, we have to tell you that almost 40% of the global companies grant a retirement plan to their employees in Mexico, and the trend is to establish a defined contribution plan. You should be aware in Mexico about that employees in Mexico are entitled to a severance payment on termination without a justified cause. And this severance may be funded through a defined benefit pension plan granting benefits equivalent to the liability. And you should also be aware about the seniority premium that in the event of death, disability, voluntary resignation, and termination without justified cause or retirement, the employee or beneficiaries are entitled to receive a severance payment also. We really appreciate having had this opportunity to share our knowledge about Mexico with you in this webinar. We want to thank you for attending to this webinar, and we want to thank Asinta's and Alliance team for supporting us in this webinar. Now, we will be very happy to answer your questions.